admitted to the hospital today for chest pain, one of the most common reasons for hospitalisation. The big question is whether your chest pain is related to your heart. Most patients admitted with chest pain are not having a heart attack. You see, there are 3 arteries that supply blood to the heart, and if one or more gets blocked by plaques, then the heart does not get enough oxygen and can get damaged. When the muscle of the heart gets damaged, then we can see a rise in the heart muscle enzymes that spill into the blood. That is why you will have a series of blood tests to measure whether there has been damage to your heart. That's right, a heart attack. Of course, you may have pain that is not related to your heart. Here's a list of possible and common causes of chest pain that are not related to your heart. Reflux, caused by acid from your stomach splashing up into your esophagus, that can be worse with belching. Ulcers in your stomach. Gallstones. Muscular pain in your ribs that can be worse when you move or take a deep breath, called costochondritis. This pain is caused by inflammation in the joint between the cartilage in the rib and the breastbone. Inflammation of the sac of your heart, called pericarditis. Problems with the aorta, the large artery that supplies blood to the rest of the body. Blood clot in the lung, called pulmonary embolism. Anxiety and panic disorder. There are many other possible causes of chest pain, but these are the most common. Based on the type of pain you are having, an EKG and blood tests help guide in knowing whether you need further testing, such as a stress test to look for real heart disease. Some questions that are important about your pain are whether your pain radiates or moves to your shoulders, gets worse with activity and exertion, whether you broke out into a cold sweat, had nausea or vomiting, or felt pressure rather than sharp pain. Now, if all of the blood tests for your heart are okay, then we will send you on your merry way, and you can see your primary doctor to talk about having a stress test as an outpatient. You may not even need a stress test if your chest pain does not sound typical and your EKG and blood tests are fine. If your chest pain sounds concerning, then you may need an exercise stress test and you will see the cardiologist. The stress test does not mean that you are under stress, but it is used to put your heart under stress to see if you get chest pain or changes in your EKG. If you do have damage to your heart, a very bad looking EKG, or a stress test that is positive, then you may need to have a cardiac catheterization. A cardiac catheterization lets us have a very close look at your coronary arteries. The cardiologist will insert a catheter through the groin and inject dye to be able to see whether your arteries have any blockages. Then, a balloon can be used to open the arteries and a stent can be placed to keep the blocked arteries open. If you have severe blockages, then you will need surgery. Yes, surgery, but we will explain that to you in detail. If all of your tests look fine, then you will be sent home and you can start thinking about eating healthy and regular exercise. Hope you feel better soon!